life in the Viking Age was defined by constant challenges, whether through the harsh Nordic winters, brutal battles, or the many physical trials of their everyday existence. Yet, amidst the fierce reputation they earned as warriors and explorers, there existed another side to the Vikings, one that is less spoken of: their profound understanding of the human body, its vulnerabilities, and the methods they employed to ease suffering. What if the Vikings, a people known for their raw strength and indomitable will, had discovered ways to numb pain long before the advent of modern medicine? This question leads us into the heart of Viking healthcare, a world where nature, ritual, and science intertwined. While their methods weren't the sterile procedures we think of today, they were practical, resourceful, and often astonishingly effective. But how did they do it? In a time when the concept of pain relief was still in its infancy, how did the Vikings manage not just to survive their countless battles, but to recover and continue their harsh way of life? Pain was an ever-present companion for the Vikings. With their history steeped in violence and danger, they experienced physical suffering regularly. Whether it was the agonizing pain of a sword wound after a raid, the crushing force of a fall from a longship, or the slow, unbearable ache from a broken bone, pain in the Viking world was both inevitable and relentless. However, the Vikings didn't just endure pain, they fought back against it, using every tool at their disposal. Before the advent of modern medical advancements, Viking warriors, sailors, and farmers had a different approach to pain. Their strategies for dealing with injury and discomfort were rooted in a profound knowledge of nature. They didn't have hospitals or advanced surgical techniques, but they understood the healing properties of plants, the calming effects of certain substances, and the power of the mind to overcome physical suffering. But the question arises, did they truly have an effective form of pain relief, or was it just the illusion of comfort to help them carry on in a world so unforgiving? The story of Viking pain relief is not simply about what they knew, but about how they applied that knowledge. It's a tale of survival, not just in the physical realm, but in the emotional and mental battles that their way of life demanded. For the Vikings, pain wasn't just something to be endured, it was something to be managed, controlled, and even harnessed. At first glance, the idea of pain relief might seem at odds with the Viking identity. These were people whose lives were built around enduring hardship. Their very culture glorified toughness, endurance, and mental fortitude. Yet, beneath this veneer of invulnerability, the Vikings understood that overcoming pain wasn't about brute strength alone. It was about the wisdom of knowing how to mitigate it, how to numb it, and how to continue fighting, living, and thriving despite it. In a sense, their mastery over pain was as much a matter of philosophy as it was of practical knowledge. But what does this ancient art of pain relief look like? How did the Vikings discover remedies that we, in the modern world, are only now beginning to understand? And perhaps most intriguingly, how can we, in our time, learn from their methods to tackle some of the most enduring medical issues of our own age? The answers lie in the past, hidden in the wisdom of healers and warriors, passed down through generations in the form of oral traditions and trial and error. As we journey through the ancient methods used by the Vikings, we'll encounter remedies that sound almost magical, herbs and potions that could ease the worst aches. But the truth is that these remedies were grounded in the deep knowledge of the natural world. What if the key to pain relief wasn't something new, but something ancient, an approach that had been hidden in plain sight for centuries? Pain is a universal experience. Across time and cultures, from the warriors of ancient times to the patients in modern hospitals, we all face it. But the way people in different eras have handled it varies greatly. In today's world, we reach for painkillers, anti-inflammatory drugs, and sophisticated surgeries. The Vikings, however, reached for something else, something simpler, but perhaps more intimately tied to the world around them. Herbs, alcohol, mental resilience, and even the mystical beliefs tied to Norse gods. All of these formed a complex and unique approach to pain relief that might just offer us valuable lessons today. This journey into Viking pain relief is not just about exploring a forgotten past. It's about uncovering knowledge that could reshape our understanding of pain, medicine, and healing. While their methods were not without their flaws, there is a certain beauty in the simplicity and resourcefulness of their approach. The Vikings' ability to endure, and even to find relief from the overwhelming physical trials they faced, can offer us a renewed appreciation for the power of nature, the mind, and the human spirit. So, as we step back into the rugged world of the Vikings, let us open our minds to the possibility that their approach to healing, though primitive by modern standards, might be just what we need to reconsider the path we've taken in our own medical practices. Could the answers to some of our most persistent health challenges lie in the distant past, waiting to be rediscovered? Only by exploring the depths of Viking healing can we begin to answer this question and see how ancient wisdom might once again have a place in our modern world. This is the story of how the Vikings, long before the invention of modern medicine, found ways to numb pain, heal wounds, and survive a world that was as unforgiving as it was wondrous. And as we look back to uncover these ancient practices, we might just discover something that could change how we think about pain forever. The history of Viking medicine is a fascinating blend of myth and reality, with many elements still clouded by mystery. The Vikings, like all ancient cultures, relied heavily on oral traditions to pass down knowledge, and their approach to medicine was no different. As a result, much of what we know about their healing practices has been passed down through sagas, stories, and folklore, making it difficult to separate fact from fiction. But in the world of Viking healthcare, there existed a unique fusion of spiritual belief and practical knowledge that shaped their approach to healing. Viking medicine was rooted in a deep understanding of the natural world, where plants, animals, and even the very earth beneath their feet held the power to heal or harm. The Vikings, much like many ancient cultures, had a strong belief in the interconnection between the physical and the spiritual realms. To them, sickness and injury were not just physical conditions, but also had spiritual and supernatural dimensions. Diseases were often seen as the work of malevolent forces or gods, and healing was a ritual as much as it was a practical endeavor. Yet, despite the mystical undertones of their medical practices, the Vikings were also highly pragmatic. They were a people who lived by the sword, who sailed across treacherous seas, and who fought in brutal battles. As a result, their knowledge of healing was not just theoretical, it was tested daily in the harsh realities of their existence. Pain, injury, and illness were as much a part of Viking life as warfare and exploration, and they needed effective ways to manage these challenges. In many ways, Viking medicine was a reflection of their resilience, balancing the mystical and the practical in order to survive. To understand Viking medicine, one must first consider the medical tools at their disposal. Unlike the sophisticated surgical instruments we have today, the Vikings relied on simple tools, knives, axes, and fire. Their healing techniques were often basic, yet effective, relying on natural remedies found in the world around them. They didn't have the benefit of advanced medical knowledge or modern technology, but they were able to craft remedies from plants, herbs, and even animal products that were surprisingly advanced for their time. One of the key aspects of Viking medicine was the use of herbs. The Vikings were well versed in the healing properties of plants, which were used to treat everything from infections to pain. Meadowsweet, for example, was one of the most commonly used herbs. This plant contains salicylic acid, the active ingredient in modern-day aspirin, and was used by the Vikings to treat pain and inflammation. Other herbs, like yarrow and juniper, were used to stop bleeding and treat wounds. The Vikings were also known to use garlic, which has antibacterial properties, to prevent infections. However, Viking medicine wasn't just about herbs. It was also about the use of rituals and spiritual practices. The Vikings believed in a host of gods and spirits who controlled every aspect of their lives, including their health. Healing, therefore, was often a divine act. Norse mythology played a significant role in their understanding of health and illness. Many Vikings turned to their gods for help when they were sick or injured, invoking the powers of healing gods like Frigg, the mother goddess, or Air, the goddess of healing. Even the great Odin, the all-father of the Norse pantheon, was associated with knowledge and wisdom, including the secrets of healing. This belief in the spiritual nature of healing is reflected in the role of the seeresses or vulvas in Viking society. These women were believed to have special powers to communicate with the gods and were often consulted for their ability to cure ailments. They combined herbal knowledge with spiritual insight, performing rituals and casting spells to heal both the body and the spirit. The vulvas were integral to the healing practices of the Viking Age, acting as a bridge between the physical and spiritual worlds. At the same time, Viking medicine was not just about mysticism, it was also deeply practical. The Vikings were a people who valued knowledge and had an inherent respect for skilled craftsmen and women. Healers, like blacksmiths, were highly respected for their knowledge and expertise. They were trusted to treat wounds, set broken bones, and even perform more invasive procedures, such as amputations. However, these procedures were often done with minimal understanding of anatomy and hygiene, and the risk of infection was high. Despite this, Vikings were able to survive many of these surgeries, likely due to their use of natural remedies and the resilience of their bodies. Viking medical practices were also shaped by their environment. Living in a harsh, often unforgiving landscape meant that they had to develop techniques that were not only effective but also resourceful. The cold, damp climate of Scandinavia presented a unique set of challenges, including the risk of frostbite, hypothermia, and respiratory illnesses. The Vikings had a variety of methods for treating these conditions, using everything from hot baths to sweat lodges to help the body expel toxins and warm itself. In fact, the Viking sauna, or sweat house, is one of their most well-known contributions to modern health practices. The Vikings understood the importance of maintaining body temperature and used heat therapy to soothe aching muscles and treat illnesses related to the cold. Even though Viking medicine was primitive by today's standards, it was rooted in a deep understanding of the human body and the natural world. The Vikings didn't have the luxury of modern diagnostics or treatment methods, but they knew what worked for them based on centuries of trial and error. Their reliance on natural remedies and simple tools made them remarkably resilient in the face of injury and illness. And while they didn't have the knowledge of germs or bacteria, their use of antiseptic herbs, like garlic and yarrow, likely helped to prevent infections and promote healing. But perhaps the most important aspect of Viking medicine was the Vikings themselves. The Viking mindset was one of toughness and resilience. These were people who had to endure extreme physical hardships on a daily basis, and their ability to manage pain was as much a mental challenge as it was a physical one. The Vikings were trained to endure pain without complaint, to push through injuries, and to continue fighting no matter the cost. This mental fortitude, combined with their knowledge of nature, made them formidable opponents in both battle and survival. In the end, Viking medicine was a unique blend of practicality, mysticism, and resilience. Their approach to healing wasn't just about the remedies they used, it was about their mindset, their connection to the natural world, and their belief in the power of the gods. While modern medicine has come a long way since the Viking Age, the ancient practices of the Vikings still hold lessons for us today. The Vikings may not have had access to the advanced technologies we have now, but they possessed something just as valuable: the wisdom of nature, the strength of the human spirit, and the determination to survive against all odds. Life in the Viking Age was unforgiving. The land was cold, the seas were treacherous, and the very nature of Viking existence demanded a constant confrontation with danger. To understand the methods the Vikings used to numb pain, we must first immerse ourselves in the raw, unyielding nature of the pain they experienced on a daily basis. Pain wasn't just a sporadic visitor, it was a constant companion. It was woven into the fabric of Viking life, from the first light of dawn to the fall of night. Pain was something the Vikings lived with, fought with, and overcame. Consider the life of a Viking warrior preparing for battle. Every raid was an unknown risk, a violent clash where injury and death were ever present. The idea of pain relief in the midst of combat seems almost inconceivable by modern standards, yet the Vikings managed. They faced the agony of swords slicing through flesh, the impact of blunt force trauma, and the crushing pain of broken bones from falls or from the sheer force of battle. These weren't injuries that could easily be ignored or dismissed. They were injuries that threatened life itself. Yet the Vikings fought on, not only enduring pain but using every means available to continue functioning and fighting. Wounds, in particular, were a common source of pain. A cut from a sword or a spear could leave a warrior writhing in agony, with little hope of proper treatment. Without antiseptics or antibiotics, infections were inevitable and the risk of sepsis, a life-threatening condition caused by the spread of infection into the bloodstream, was high. Yet, Viking warriors could not afford to stop and rest for long. The urgency of battle and the harsh reality of their existence meant that they had little choice but to push through the pain. The same went for the longships they sailed. The Viking seafarers endured constant wear and tear on their bodies, cold, exhaustion, the ever-present threat of injury. Even outside of battle, the physical toll was unrelenting. It wasn't just the wounds of combat, it was the agony of the sea and the hard, unforgiving terrain they traveled. The physical pain that plagued the Vikings was compounded by the emotional and psychological toll of their way of life. The Vikings lived in a world where death and violence were omnipresent. The battle for survival was not just a physical one, but a mental and emotional one. Imagine the weight of losing a brother in arms or a loved one to the brutality of life. The trauma of witnessing death, the pain of grief, and the ongoing struggle to find meaning in a world where every day could be one's last, all of this added layers to the suffering. Pain was not just physical, it was emotional, spiritual, and psychological. The Vikings had to learn to manage not just their physical injuries but the toll that life itself took on their souls. For the Vikings, pain wasn't something to be feared, it was something to be overcome. Their entire culture was built on the principle of resilience. The Norse myths, which were an integral part of Viking life, glorified figures like Odin, the All-Father, who sacrificed his eye for wisdom, and Thor, the mighty god of thunder, who wielded his hammer to protect the gods and humanity. These mythic stories were not just about gods, they were allegories for the Viking worldview, a worldview in which endurance, suffering, and overcoming obstacles were viewed as noble traits. The idea that one could face pain head-on and continue to function was central to their identity. In this harsh environment, it was survival of the fittest. Those who couldn't endure pain or who faltered in the face of injury wouldn't last long. But it wasn't just warriors who experienced pain. Viking farmers and craftsmen, who worked long hours in the fields or in the forge, also had to contend with the physical strain of their labor. The constant lifting, the chopping of wood, the long hours spent tending to animals or crops, it all took a toll. Injuries from tools, accidents, or the harsh weather conditions were common. Imagine the pain of frostbite from the freezing cold, or the back-breaking strain of plowing fields in the unforgiving landscape of Scandinavia. Even the act of childbirth was dangerous, with mortality rates high for both mothers and infants. And yet, life continued. There was no time to stop and dwell on pain. Vikings had to carry on, pushing through their suffering because survival depended on it. The Vikings didn't have the luxury of modern medicine to dull the pain, nor did they have the advanced tools to perform sophisticated surgeries. They relied on their resourcefulness, using the environment around them to find relief. They had a unique way of blending both the practical and the mystical to address the unrelenting pain they faced. Herbs, alcohol, and even the spiritual beliefs tied to their gods were part of their healing toolkit. While we might look at their methods today and wonder at their effectiveness, the reality is that they were the product of centuries of trial and error, observation, and adaptation to the harsh environment in which they lived. In battle, pain was something that had to be managed in real time. Imagine being a Viking warrior in the midst of a raid, feeling the sharp sting of an arrow or the blinding pain of a sword wound. The choice was simple: fight or die. There was no time to feel sorry for oneself, no room for weakness. Warriors had to toughen their minds and bodies to the point where pain was something to be endured, something to be suppressed so that the battle could continue. The adrenaline of battle would have helped dull some of the pain, but even that wouldn't be enough to mask the severity of injuries that could lead to death. Yet despite the overwhelming pain, the Vikings were renowned for their ability to endure. It wasn't just physical strength they relied on, it was mental fortitude. The Viking ethos was built around the idea that a warrior's strength lay not just in their swordsmanship but in their ability to face death, injury, and pain without flinching. The idea of honorable death played a major role in their psyche. To die bravely in battle was considered an honor, a fate to be welcomed, not feared. For a Viking warrior, the experience of pain was inextricably linked with their identity. It wasn't something to be avoided, but something to be faced head-on, with courage and resolve. The overwhelming reality of pain was something the Vikings had to live with every day, but it was also something they learned to manage. The ability to fight through the agony of an injury, to rise after a fall, to push on despite the odds, this was what set the Vikings apart. They lived in a world where death was always a heartbeat away, where the next battle could be their last. Yet they found ways to keep moving forward, driven by their belief that the battle wasn't over until their last breath was taken. Pain was inevitable, but so was their determination to endure it. Ultimately, pain in the Viking Age was not just a physical reality, it was an integral part of their identity. It was a challenge to be faced, a test of one's strength and willpower. In the world of the Vikings, to feel pain was to be human. To endure it was to be a warrior. And it was through this enduring spirit, the refusal to give up in the face of overwhelming agony, that the Vikings truly proved their mettle. The harshness of their world may have caused pain, but it also forged a people whose resilience and resolve remain legendary to this day. The Vikings, known for their fearlessness in battle, their seafaring skills, and their harsh way of life, lived in a world where pain was an everyday reality. Whether it was from injuries sustained during raids, the physical toll of their labor, or the illnesses that plagued them, pain was something they had to endure regularly. But how did they manage this relentless suffering without the advanced painkillers and anesthetics we have today? In a time when medicine was more art than science, the Vikings developed unique, resourceful techniques to numb the body and ease the agony of wounds, illnesses, and fatigue. Their methods were deeply intertwined with the natural world, relying on plants, rituals, and a unique mental toughness that allowed them to push through unimaginable pain. The first and perhaps most well-known technique used by the Vikings was the application of herbal remedies. The natural world provided a wealth of options for the Vikings, and they had an extensive knowledge of the healing properties of plants. These remedies were often combined with their belief systems, blending the practical with the spiritual. For instance, meadowsweet, a plant native to Scandinavia, was one of the primary tools in their arsenal for numbing pain. Meadowsweet contains salicylic acid, the active ingredient in modern-day aspirin, and the Vikings used it to treat aches, pains, and inflammation. This herbal remedy, although primitive by today's standards, was incredibly effective and widely used by the Vikings to dull the sharpness of physical pain. Another plant widely used was yarrow, which the Vikings utilized to stop bleeding and reduce inflammation. Yarrow was also believed to have magical properties, adding a spiritual layer to its physical effects. The Vikings, like many ancient cultures, viewed plants not just as medicinal tools but as sacred gifts from the gods, capable of bridging the physical and spiritual realms. To them, the act of using a plant for healing wasn't merely a medical intervention, it was a ritual, an act of reverence to the natural world that sustained them. These herbs were often used in combination, creating concoctions that could ease pain, reduce swelling, and help the body heal faster. But herbal remedies were not the only technique the Vikings employed to numb pain. Alcohol played a significant role in their medical practices. Mead, the honey-based alcohol consumed by the Vikings in large quantities, was often used to dull pain. The Vikings had an intimate relationship with alcohol, and it wasn't just a social or celebratory drink, it was also a medicinal one. In battle, after a warrior sustained an injury, they would drink mead to reduce the pain, making it easier to carry on despite their wounds. The alcohol acted as a temporary anesthetic, numbing the senses and allowing the injured Viking to continue fighting or moving until they could seek further treatment. Interestingly, the Vikings were not the only ones to discover the pain-numbing properties of alcohol. Many ancient cultures, from the Greeks to the Egyptians, used alcohol for medicinal purposes. Yet, the Vikings had a unique relationship with it, incorporating it into their healing practices as part of a broader belief system that also involved the gods and spirits. Alcohol served not just as a numbing agent but also as a form of sacrament. It was a ritualistic drink, and the act of drinking it to alleviate pain could be seen as a spiritual offering or a form of communion with the gods. When it came to more serious injuries, such as broken bones or deep cuts, the Vikings had to rely on a combination of physical resilience and rudimentary medical techniques. In the absence of advanced surgical tools, the Vikings had to make do with what they had, simple tools such as knives, blades, and fire. Amputations, for example, were a real possibility in the Viking world. If a warrior lost a limb in battle or sustained a wound that became infected, the only way to save them might be to remove the affected part of the body. Amputation was often performed without anesthesia, relying instead on the warrior's mental toughness and the use of alcohol or mead to dull the pain. But even more than the physical tools, it was the Viking mindset that played a critical role in their ability to endure such severe pain. The Vikings believed that enduring pain was a way of proving one's strength, resilience, and worth. The stories of Viking warriors who endured unimaginable suffering in battle, only to rise and continue fighting, became legendary. Pain was seen not as something to fear but as something to conquer. This psychological fortitude allowed the Vikings to tolerate extreme discomfort and even continue their day-to-day activities despite being wounded or ill. In addition to herbal remedies and alcohol, the Vikings also used heat to manage pain. The cold, harsh climate of Scandinavia made it essential for the Vikings to find ways to stay warm, and they discovered that heat could be used not only to treat cold-related injuries like frostbite but also to soothe aching muscles and joints. They employed saunas or sweat lodges to help relax the body and reduce pain from muscle fatigue or injuries. The use of heat therapy was an ancient practice that had been employed by many cultures, but the Vikings were particularly adept at utilizing it to recover from the physical toll of their harsh environment. The sweating process, combined with the warmth, would allow the body to relax and heal faster, reducing the perception of pain. In the face of so many challenges, the Vikings developed a highly effective, albeit primitive, system of pain relief. Their methods were not just about reducing pain in the moment, they were about survival. In a world where death could come quickly, whether from injury, infection, or disease, the ability to manage pain and continue functioning was vital. The Vikings did not have the luxury of laying down to rest or seeking out professional medical care. They had to keep moving, keep fighting, and keep building. Pain relief, then, wasn't just about comfort, it was about necessity. It was a tool for survival. What is most remarkable about the Viking approach to pain is not just the techniques they used but the philosophy behind their use. Pain was not something to be avoided, it was something to be managed, understood, and overcome. The Vikings accepted pain as part of life, as something that was always present but could be endured and controlled through knowledge, resilience, and the use of natural resources. They didn't seek to eradicate pain entirely. Instead, they sought to empower themselves to live with it, to navigate the harsh world around them without being paralyzed by it. In this way, Viking pain relief was deeply intertwined with their culture and worldview. It was about more than just the physical body. It was about strength of character, mental resilience, and the ability to keep moving forward. The Vikings didn't shy away from suffering. Instead, they met it head-on, armed with a combination of herbal remedies, alcohol, and an unshakable belief in their ability to survive. Their pain relief techniques were not perfect by modern standards, but they were effective within the context of their world. Today, we might look at their methods and marvel at how far we've come with modern painkillers, surgeries, and advanced medical treatments. But the Vikings' approach to pain relief was a testament to their ingenuity, their resourcefulness, and their incredible resilience. They found ways to survive in a world that was far more brutal than the one we live in today. Their ability to manage pain, both physical and emotional, was a cornerstone of their success. And in this ancient wisdom, there may be lessons for us in how to face our own challenges, pain, and suffering with courage and determination. The Vikings, living in an age without modern pharmaceuticals or medical knowledge, relied heavily on the natural world around them to treat a wide range of ailments. Their understanding of the medicinal properties of plants, herbs, and other natural substances was both profound and practical, shaped by centuries of trial and error, tradition, and close observation of the environment. Pain relief was just one aspect of their holistic approach to healing, and the Vikings used nature as their most powerful tool. The role of herbs and natural remedies in Viking medicine is often underestimated, but these ancient healing practices reveal a sophistication and depth of understanding that modern medicine sometimes overlooks. Herbal remedies were central to Viking life, and the Vikings' knowledge of plants was vast. Every community had its healers, often women, known as vulvas, who were believed to have both spiritual and medicinal powers. These women were often consulted for ailments ranging from physical injuries to emotional distress, and their role was critical in maintaining the health and well-being of the Viking people. The vulvas combined herbal knowledge with spiritual practices, performing rituals and offering guidance based on their connection to the gods and the natural world. One of the most well-known herbs used by the Vikings was meadowsweet, a plant that grows abundantly in Scandinavia. Meadowsweet contains salicylic acid, the active ingredient in aspirin, and was one of the Vikings' primary tools for treating pain. The Vikings did not have the modern understanding of chemical compounds, but they knew from experience that meadowsweet could reduce inflammation and relieve pain. It was commonly used to treat headaches, joint pain, and other inflammatory conditions. The Vikings also made teas and tinctures from meadowsweet, which would be consumed to ease pain or as a preventative measure during long voyages or harsh winters. The healing properties of meadowsweet are still recognized today, as modern medicine has rediscovered its power as an anti-inflammatory and pain-relieving agent. Yarrow was another essential herb in the Viking medicine cabinet. Known for its ability to stop bleeding, yarrow was used by the Vikings to treat wounds and prevent infection. It was often applied directly to cuts and abrasions, either as a poultice or a powder, to stop the bleeding. In addition to its hemostatic properties, yarrow was also used for its anti-inflammatory effects and its ability to ease muscle pain. The Vikings also used yarrow in their healing rituals, as it was thought to have magical properties that could protect warriors from harm. Its use in Viking medicine was likely based on both practical knowledge and spiritual beliefs, as yarrow was considered a sacred herb by the Norse people. Juniper berries were another natural remedy used by the Vikings, particularly for their antiseptic properties. Juniper was burned in small quantities during Viking rituals, believed to ward off evil spirits and purify the air. But beyond its spiritual uses, juniper was also highly effective in treating infections and respiratory issues. The Vikings would brew juniper berries into teas or use them to create salves for wounds. Juniper has strong antibacterial and antifungal properties, making it a useful remedy for preventing infection in a time before antibiotics were known. It also has a calming effect on the respiratory system, and its use in treating chest infections and coughs would have been vital for Viking sailors who spent long periods at sea, exposed to harsh winds and cold. Garlic, a staple in many ancient healing traditions, was another plant that the Vikings turned to for its medicinal properties. Known for its ability to fight infections and boost the immune system, garlic was used by the Vikings to treat a variety of conditions, from the common cold to more severe infections. Garlic's strong antibacterial properties made it a natural choice for Viking healers who faced the constant threat of wound infections, particularly after battles. It was also believed that garlic had the power to ward off evil spirits, making it an important part of both medical and spiritual practices. Beyond herbs, the Vikings also utilized other natural substances to treat pain and illness. Honey, for example, was used as a wound dressing because of its antibacterial and healing properties. Viking healers would apply honey to open wounds to prevent infection and promote healing. Honey's ability to soothe and heal was also recognized in the treatment of sore throats and digestive issues, making it a versatile remedy for a wide range of ailments. The Vikings, living in close proximity to nature, understood the value of such substances and used them to their full advantage. The Vikings didn't limit their use of plants to herbs. They also utilized the medicinal properties of animal products. For example, the use of animal fat in wound healing was common. Animal fat, particularly from bears or seals, was known to have soothing properties and was used in salves to treat burns, cuts, and bruises. Similarly, fish oil was utilized for its anti-inflammatory benefits, helping to ease joint pain and arthritis, conditions common among the Vikings who spent much of their lives at sea or engaged in physical labor. The Vikings also made use of the physical environment in which they lived. The natural hot springs of Iceland, for example, were believed to have healing properties. These hot springs were used not only for relaxation but also for their therapeutic effects on sore muscles, joint pain, and fatigue. Heat therapy was a critical part of Viking medical practices, and the use of natural heat sources to soothe and heal the body was an integral aspect of their approach to pain relief. While many of these remedies may seem simple by modern standards, they were remarkably effective, especially when compared to the limited medical knowledge available during the Viking Age. What's more, Viking medicine was holistic. It wasn't just about treating the physical body, it was about balancing the body, mind, and spirit. This is where their deep connection to nature and the divine played a key role. Viking healers often performed rituals before administering any treatments, invoking the gods for assistance and protection. The Vikings believed that illness and injury were not only physical ailments but also signs of spiritual imbalance. By treating the whole person, body, mind, and soul, they were able to heal more effectively than we might initially think. The use of herbal remedies by the Vikings was not just a practice rooted in desperation, it was an incredibly sophisticated system of healing based on a profound understanding of the natural world. The Vikings knew how to harness the power of plants to address specific ailments, and their knowledge of the medicinal properties of herbs was passed down through generations, ensuring that this wisdom survived the test of time. The Vikings' ability to heal themselves with the resources at hand was a testament to their resourcefulness and ingenuity, allowing them to thrive in some of the most challenging environments in history. What is perhaps most striking about Viking herbal medicine is its timelessness. Many of the remedies used by the Vikings, meadowsweet, yarrow, juniper, garlic, are still in use today in various forms of herbal medicine. In a sense, the Vikings' approach to healing was ahead of its time. Their use of natural remedies was not only practical but also deeply intertwined with their spiritual and cultural beliefs. For the Vikings, healing was not just about the physical body, it was about aligning oneself with the natural world, invoking the power of the gods, and finding balance in a world that was often chaotic and harsh. The wisdom of their herbal remedies continues to echo through time, offering valuable lessons about the connection between nature, health, and the human spirit. For the Vikings, alcohol was more than just a source of pleasure or a social lubricant. It played a crucial role in their approach to pain relief, healing, and even mental fortitude. Their relationship with alcohol was complex, deeply interwoven with their social, spiritual, and medical practices. Mead, ale, and other alcoholic beverages were woven into the very fabric of Viking life, not just as a form of intoxication, but as a powerful tool to alleviate pain, enhance spiritual experiences, and bolster their legendary resilience in battle and daily life. Mead, the honey-based alcoholic beverage, was the drink of choice for many Vikings. It wasn't just a drink for celebration, it was consumed regularly, for both its nutritional value and its medicinal properties. The Vikings had a deep understanding of the benefits of alcohol when used appropriately. In battle or after a strenuous physical task, the consumption of mead would dull the sharpness of pain, allowing warriors to push through injuries or exhaustion. In an age with little access to painkillers or anesthetics, alcohol served as a crucial stopgap. It helped dull the senses, allowing warriors to continue fighting or performing tasks despite the physical toll. After a raid or a day of battle, when wounds and bruises were the inevitable outcome, a drink of mead was often the first step in the healing process. It helped relieve the shock and anxiety that followed an injury, creating a temporary state of numbness that would allow the body to rest and recover. But it wasn't just physical injuries that alcohol helped to numb. The emotional and psychological toll of Viking life was also immense. The Vikings lived in a world where death was a constant companion, whether through battles, raids, or the harsh conditions of the north. Loss and grief were as much a part of life as the harsh winters and the brutality of combat. For many Vikings, alcohol provided temporary solace from these emotional burdens. Mead, in particular, was imbued with spiritual significance. It was a drink not only for the body but also for the soul. When consumed in ritualistic settings, it was believed to connect the drinker with the divine, with the gods, and with the deeper aspects of the Viking worldview. In this sense, mead was seen as more than just a beverage. It was a bridge to the spiritual world, a sacred elixir that could provide comfort during times of hardship. Alcohol was also used in rituals and sacrifices. Vikings believed that their gods, particularly Odin and Thor, had a strong connection with the forces of nature and battle, and mead was often consumed during these sacred acts. It wasn't just a form of intoxication, it was a form of communion, an offering to the gods in the hope that they would bestow strength, protection, and wisdom. The Vikings' consumption of alcohol, particularly mead, was symbolic of their deep belief in the interconnectedness of the physical and spiritual worlds. Drinking wasn't merely about indulgence, it was about invoking divine favor, about sharing in a communal bond that transcended the human realm and reached out to the divine. Despite the deep connection between alcohol and spirituality, the Vikings also recognized that alcohol could be dangerous. While mead and ale were essential to their cultural and medicinal practices, they were also aware of the risks of overindulgence. Excessive drinking could lead to reckless behavior, poor decision-making, and in some cases, the breakdown of social order. Alcohol had the potential to both heal and harm, to create bonds and to destroy them. Vikings understood the importance of balance when it came to alcohol use, incorporating it into their lives as both a medicine and a ritual, but always with an awareness of its potential dangers. This understanding of balance was central to Viking culture, and it reflected their broader worldview, the importance of harmony between the physical, emotional, and spiritual realms. The Vikings didn't limit their alcohol consumption to just mead. They also brewed ale, which was widely consumed during feasts, celebrations, and everyday life. Ale, made from barley or other grains, was a more accessible drink for many Vikings, particularly those who didn't have access to honey. Ale was consumed in great quantities, and its consumption was often tied to communal gatherings and social bonds. Viking feasts, where stories of gods and warriors were recounted, were often accompanied by large quantities of ale. These gatherings helped strengthen social ties, and alcohol played a key role in the communal aspect of Viking life. It was during these feasts that warriors would share their experiences of battle, bond with their fellow soldiers, and honor the gods. The consumption of ale, then, was not just a way to escape pain or hardship, it was a way to solidify relationships, create memories, and build a sense of shared identity. But beyond its role in pain relief and social bonding, alcohol also had a practical function in Viking life. As a preservative, alcohol helped to extend the shelf life of food. Mead and ale were often consumed during long sea voyages, where they served as an important source of hydration and nutrition. The Vikings, known for their seafaring prowess, would embark on long journeys across the seas, often facing dangerous conditions and limited resources. Alcohol helped to stave off infection and preserve their health during these arduous trips. The high alcohol content of mead, in particular, made it a more durable drink, able to withstand the harsh conditions of long voyages. It was a practical solution to the challenge of maintaining health and well-being during these extended expeditions. On a more philosophical level, alcohol in Viking culture represented resilience. The Vikings' ability to endure hardship and push through pain was a defining characteristic of their culture, and alcohol played a role in this resilience. When facing overwhelming physical exhaustion, injury, or emotional distress, alcohol helped provide a temporary reprieve, allowing the Vikings to continue with their demanding lives. In this way, alcohol was not just a tool for escaping pain, but a means of reinforcing the Viking spirit, enabling them to face the hardships of their world with a sense of courage and determination. The Vikings' relationship with alcohol was, in many ways, an extension of their broader relationship with the natural world. Just as they harnessed the power of herbs and plants for healing, they also recognized the power of alcohol to both heal and harm. It was a substance that could both soothe and invigorate, both dull pain and bring clarity. The Vikings, with their keen understanding of nature, used alcohol as a tool to navigate the many challenges of their world, from the harsh physical conditions they faced to the emotional toll of their daily lives. Today, when we look at the role of alcohol in Viking culture, we can see the deep wisdom they possessed in understanding its dual nature. Alcohol was not just a means of escaping pain, it was a tool for survival, healing, and spiritual connection. The Vikings were not simply using alcohol to numb themselves, they were using it as a way to engage with the world, to connect with each other, and to face the overwhelming challenges of their environment. In the end, alcohol, like many of the Viking remedies for pain and illness, was not a quick fix. It was part of a larger strategy for resilience, a way to stay strong, endure hardship, and keep moving forward in a world that was as brutal as it was beautiful. When we think of Viking medicine, The first image that often comes to mind is of herbal remedies, meat for pain relief, and mystical rituals. However, Viking surgery was also an essential part of their medical toolkit, one that, while rudimentary and brutal by today's standards, was surprisingly effective in certain circumstances. The Vikings, though not trained in the way modern doctors are, possessed a practical knowledge of the human body and had the resourcefulness to perform necessary surgical procedures to save lives. While they did not have the advanced tools or sterilization techniques that modern medicine relies on, Viking surgery was nevertheless an important part of their resilience and survival. In the context of Viking warfare, surgery was often a matter of life and death. For a warrior who had been injured in battle, particularly with cuts from swords, axes, or spears, the odds of survival were slim if immediate attention was not given. Wounds from weapons were common, and while some might have been treated with herbs, poultices, or alcohol to numb the pain, others required immediate surgical intervention. The primary aim was always to stop bleeding, remove any foreign objects such as arrows or spearheads, and tend to fractures or broken bones. The challenge, of course, was that the Vikings had no antibiotics, antiseptics, or even a clear understanding of infection. Their surgical knowledge was largely based on trial and error, passed down through generations of warriors and healers. One of the most common surgical procedures performed in Viking society was the amputation of limbs. In the brutal conditions of Viking life, where injuries in battle or accidents at sea could lead to devastating trauma, amputations were sometimes necessary to save a person's life. The Vikings were well aware of the dangers posed by wounds, especially the risk of infection, and when a limb was too damaged to save, the only solution was to cut it off. The procedure, while performed in a crude and sometimes rushed manner, was nonetheless effective in preventing the spread of infection. The method often involved the use of simple tools such as knives, axes, or swords. Though the Vikings lacked modern surgical instruments, their ability to perform amputations under harsh conditions was a testament to their ingenuity and their commitment to survival. Once the decision to amputate was made, the procedure was carried out quickly. The first step was to bind the limb above the wound with a tourniquet or a tight cord to stop the flow of blood. This was crucial in preventing the patient from bleeding out during the surgery. Once the area was sufficiently numb, which was often achieved through alcohol or the use of herbal remedies, the surgeon, typically a skilled warrior or healer, would use a sharp blade to sever the limb. The surgery would be followed by the application of herbs or animal fat to the wound to aid in healing and to prevent infection. The Vikings were remarkably resourceful, using everything at their disposal to ensure the patient's survival. Though amputation was one of the most extreme forms of surgery, it was not the only one practiced by the Vikings. Trepanation, or the removal of part of the skull to treat head injuries, was also performed, though it was far less common. Trepanation was typically used when a person sustained a serious blow to the head, whether from a weapon or a fall, and there was concern about swelling or brain injury. The practice involved drilling or scraping a hole in the skull to relieve pressure on the brain. Though this procedure might sound terrifying by modern standards, evidence suggests that many Vikings survived this operation and lived for years afterward, often returning to their lives as warriors or laborers. The Vikings did not have the sophisticated knowledge of the brain that we have today, but they understood the importance of relieving pressure from head injuries, and their methods, while crude, were effective enough to save lives. Other surgical practices included the setting of broken bones. Vikings were no strangers to injuries, whether from accidents, raids, or battles, and fractures were common. Without the benefit of modern casts, the Vikings relied on splints made from wood, leather, or other materials. They would set the bone as best they could, using their hands or simple tools, and then bind the limb with cloth or leather strips to hold it in place. The healing process would be aided by rest, the application of herbal remedies, and the use of alcohol or other pain-relieving substances. While the bones might not heal as perfectly as they would with modern treatments, Viking healers had a good understanding of the importance of immobilizing fractures to prevent further injury and ensure proper healing. In addition to these physical surgeries, Viking healers also performed a form of surgery to treat wounds inflicted by weapons. In many cases, a weapon such as a sword or arrow would leave a deep wound that needed immediate attention. The first priority would be to stop the bleeding, which could be done with pressure or by applying a coagulant such as yarrow. The next step would be to remove any foreign objects, like arrows or fragments of weapons, from the wound. This would have been a delicate process, as removing an embedded object without causing further damage to surrounding tissues was critical. The Vikings, having no modern tools to aid in such procedures, would have had to rely on their skill and the sharpness of their knives to extract these objects with minimal harm. Infections, of course, were a major concern in Viking surgery. Without knowledge of bacteria or proper sterilization techniques, the risk of infection after surgery was high. However, the Vikings made use of natural antiseptics to reduce this risk. Herbs like garlic, yarrow, and juniper, which were known for their antimicrobial properties, were commonly used to clean wounds. Additionally, the Vikings might apply animal fats or honey to wounds, as these substances were believed to have healing properties and could prevent infection. Though these practices were not entirely foolproof, they undoubtedly helped to reduce the incidence of infection and allowed many Vikings to survive wounds that would have been fatal in other cultures. The success of Viking surgery, despite the lack of modern medical knowledge, was largely due to the warriors' mental resilience and the skill of the healers. The Vikings' warrior culture prized strength, endurance, and the ability to fight through pain. This mindset played a critical role in their ability to survive even the most brutal surgeries. The Vikings believed in the concept of an honorable death, and to survive an injury that would have claimed another person's life was a mark of great strength. This cultural attitude towards pain and injury gave Viking warriors the mental fortitude to endure even the harshest surgical procedures. What is truly remarkable about Viking surgery is not just the procedures themselves, but the broader context in which they took place. The Vikings lived in a world where danger was a constant companion. Whether through the chaos of battle, the treacherous conditions at sea, or the everyday accidents of life, the Vikings had to deal with injuries on a regular basis. Surgery, though rudimentary, was a necessary skill that could mean the difference between life and death. The Vikings may not have had access to the sophisticated tools and knowledge we take for granted today, but their resourcefulness, their deep understanding of the body, and their determination to survive helped them to manage injuries and heal in ways that were remarkably effective for their time. In conclusion, Viking surgery was a brutal but effective means of dealing with the injuries that plagued their society. Through a combination of simple tools, natural remedies, and mental toughness, the Vikings developed surgical practices that allowed them to survive in a world filled with danger. While their methods may seem crude by modern standards, they were an essential part of Viking survival, ensuring that warriors could continue fighting and that the people of Viking society could endure the harsh realities of life in the north. The Vikings' resilience in the face of pain and injury remains one of the most striking aspects of their culture, and their approach to surgery was just one of the many ways in which they overcame the challenges of their brutal world. The Viking worldview was profoundly shaped by their belief in the gods, the supernatural, and a deep connection to nature. Their understanding of pain, illness, and healing was not purely medical, it was intrinsically linked to their spiritual beliefs. To the Vikings, pain was not just a physical experience, it was also a spiritual and psychological one. They saw pain and suffering as tests of strength, endurance, and willpower, and believed that enduring pain could bring them closer to the divine. Pain was viewed as both a challenge and a lesson, one that could be endured through prayer, ritual, and connection to the gods. The Viking pantheon, with its powerful gods and goddesses, played a central role in how they approached pain and suffering. The Vikings worshipped a variety of deities, each representing different aspects of life and death. Chief among these was Odin, the All-Father, god of wisdom, war, and death. Odin, who sacrificed his own eye for wisdom, was seen as a god who embraced pain and sacrifice as a means of gaining greater understanding. For the Vikings, Odin represented the ultimate example of resilience, as he was willing to endure suffering in pursuit of knowledge and strength. Warriors, in particular, looked to Odin for guidance in dealing with the pain of battle and the hardships of life. His mythology was filled with stories of self-sacrifice and endurance, and these tales resonated deeply with the Viking warriors who often faced brutal physical trials in their daily lives. Thor, the god of thunder, was another figure central to Viking beliefs, particularly when it came to strength and courage. Known for his immense physical power and his role as protector of both gods and men, Thor represented the ideal of physical resilience. His hammer, Mjolnir, was said to be a powerful weapon capable of crushing enemies, but it was also a symbol of protection and defense. For the Vikings, invoking Thor's strength during times of pain or distress could provide them with the mental fortitude needed to endure. The belief in Thor's protective power was a psychological balm in times of battle or injury. The Vikings would often turn to their gods in moments of suffering, praying for their intervention or guidance, believing that their deities could help them endure whatever pain they were facing. The Valkyries, female warrior spirits who served Odin, also played a key role in Viking conceptions of pain and death. The Valkyries were believed to choose which warriors would live and which would die in battle, guiding the souls of the fallen to Valhalla, the Hall of the Slain. This afterlife was reserved for those who died honorably in combat, and it was a place where warriors could feast, fight, and prepare for the final battle at Ragnarok, the end of the world. For a Viking warrior, dying in battle was not something to fear, it was a source of honor. Pain, in this context, was viewed as a temporary suffering, a necessary trial on the path to an honorable death. The belief in Valhalla provided comfort in the face of pain, as warriors knew that their suffering would be rewarded with a place in the halls of the gods. Rituals played a significant role in the Viking approach to pain and healing. The Vikings believed that the spiritual and physical realms were intertwined, and healing was as much about spiritual alignment as it was about physical restoration. Healing rituals were often performed by seers, wise women, or shamans, who were believed to have the power to commune with the gods and spirits. These healers, known as Valvas, were highly respected in Viking society and were often called upon to perform rituals for pain relief, to ward off evil spirits, or to help the wounded recover from battle. The Valvas would invoke the gods, perform sacred chants, and offer sacrifices to gain divine favor. Healing wasn't just a physical process, it was a spiritual journey that required alignment with the divine forces that governed the world. In addition to the Valvas, Viking warriors themselves often engaged in personal rituals to endure pain. Before battle, warriors would make offerings to the gods, asking for strength and protection. They might recite prayers or chants, or even carve protective runes into their weapons or bodies. The belief in the power of these rituals was profound, as the Vikings saw the gods as actively involved in their lives. Invoking the gods through these actions was not just about seeking protection, it was about affirming one's connection to the divine and reinforcing one's own courage and resolve. In the face of pain, these rituals served as mental and spiritual tools, helping the Vikings steel themselves against fear and suffering. The Vikings also believed in the power of fate, or WRD, a concept that was central to their worldview. WRD was the belief that the events in life were predetermined by the gods, and that individuals had limited control over their destinies. This belief could be both comforting and unsettling, as it meant that suffering and pain were seen as part of one's fate. However, rather than accepting pain passively, the Vikings believed that it was how one responded to pain that mattered most. They saw pain as a test, a challenge to overcome with strength and honor. Enduring pain was a sign of one's strength of character, and those who faced pain without complaint were thought to be blessed by the gods. The acceptance of fate, combined with the belief that one could endure suffering with honor, was a powerful motivator for the Vikings. The practice of meditation, while not formally recognized as it is today, was also a part of Viking spiritual life. In the moments before battle, warriors would often enter a trance-like state to prepare themselves for the pain and violence they were about to face. This mental preparation helped them endure injuries and setbacks during battle. The ability to focus the mind, to separate oneself from the physical pain of battle, was an essential survival skill. This mental toughness was not seen as something that was innate, but rather as something that could be cultivated through practice and belief. The Vikings viewed the mind and spirit as integral parts of their ability to endure pain, and they took great care to cultivate mental fortitude through rituals, prayer, and personal discipline. Viking funeral rites also reflected the belief that pain, suffering, and death were not the end, but part of a larger, cyclical journey. The Viking funeral was a grand affair, involving sacrifices, offerings to the gods, and the sending off of the deceased to the afterlife with honor. This practice reinforced the belief that death was not an end, but a transition to a new form of existence. The pain of loss was eased by the belief that the departed would live on in the afterlife, feasting in Valhalla or fighting alongside the gods. The ceremony was not only a way of honoring the dead but also a way of reaffirming the belief that pain and death were part of the larger cosmic order, a fate that could be faced with courage and dignity. The Vikings' religious beliefs about pain and suffering were both practical and spiritual. They helped to frame pain as something that could be endured with dignity, resilience, and courage. Pain was not seen as a punishment, but as a necessary part of life, one that could be faced with the right mindset, the right rituals, and the right connection to the divine. The gods, spirits, and rituals of Viking culture played an integral role in how the Vikings approached suffering, offering them both comfort and strength in the face of hardship. Whether it was in battle, during illness, or in the face of personal loss, the Vikings used their faith to transform pain into something meaningful, an opportunity for spiritual growth, a test of resilience, and a step toward an honorable death. Viking warriors were renowned for their fearlessness in battle, their strategic brilliance, and their remarkable ability to endure physical pain. The world in which they lived was one where violence and injury were common occurrences, and for the Vikings, pain was not something to avoid but something to survive, endure, and even embrace. Whether they were raiding distant lands, defending their villages, or engaging in the brutal conflicts that defined their era, Viking warriors were constantly exposed to the harsh realities of combat, where pain was both inevitable and part of the price of survival. In a society that placed such a high value on martial prowess, a warrior's ability to withstand pain was as important as his ability to wield a sword or axe. Viking warfare was not a matter of mere skirmishes or clean, swift battles. It was a brutal, up-close and personal form of fighting, where weapons like axes, swords, and spears were used with deadly intent. The Vikings did not engage in the kinds of battle strategies that we might associate with modern warfare. There were no drone strikes, no distant artillery fire. Combat was fought at close range, with the sounds of clashing metal, screams of pain, and the stench of blood filling the air. In such a violent and chaotic environment, injuries were frequent, and the pain that came with those injuries was often immense. But the Vikings, with their indomitable spirit, learned to live with pain, endure it, and continue fighting despite it. The nature of Viking battle injuries was a direct result of the brutal style of warfare they practiced. Viking warriors were often heavily armed with axes, swords, and shields, using their strength and skill to inflict devastating blows. The weapons they wielded were designed to cut through armor, cleave through flesh, and break bones. A Viking warrior's injuries were often severe, resulting in deep lacerations, broken bones, and even dismemberment. Yet, despite the sheer physical trauma that accompanied these wounds, many Vikings chose to continue fighting. In some cases, warriors would fight through the pain, refusing to yield, and this was considered a mark of great strength and honor. The Viking code of conduct prized courage in the face of pain, and warriors who were able to endure the agony of their injuries without retreating were often held in the highest regard. One of the most common forms of injury in Viking warfare was the sword wound. Viking swords were formidable weapons, designed for both slashing and thrusting. A strike from a Viking sword could easily cut through armor, slicing through flesh, muscle, and bone. Such wounds were often deep and painful, leaving the warrior with a choice: either succumb to the pain and retreat, or push through it and continue the fight. The Vikings, with their warrior ethos, often chose the latter. Even if a warrior was struck down and severely injured, there was a deep cultural expectation that they would not give up easily. They might be aided by fellow warriors, but the expectation was always that they would fight until they could fight no longer. Another form of injury was the spear wound. The Vikings made extensive use of spears, both as throwing weapons and as close combat tools. A spear thrust could pierce the body with devastating force, particularly if the warrior was caught off guard or unprotected. The pain of being impaled by a spear was excruciating, yet many Viking warriors endured such wounds, knowing that to give in to the pain would be to dishonor themselves and their comrades. Even if the injury didn't prove fatal, the warrior would have to deal with the agony of a deeply embedded spearhead. Removing it was no easy task. It would often require the warrior to be held down or immobilized while a fellow warrior or healer worked to extract the weapon. For many Vikings, the idea of enduring this kind of pain was tied to their belief in the nobility of sacrifice. Their warrior's code demanded that they be willing to bear great pain for the sake of their people and their gods. While the Viking warriors' physical endurance was remarkable, their ability to mentally overcome pain was equally important. The Vikings were a people who celebrated the strength of mind as much as the strength of body. They believed that the mind had the power to transcend the body's limitations, and that with enough willpower, a warrior could overcome any obstacle, pain included. This belief in mental fortitude was deeply embedded in Viking culture and was reflected in their mythology and sagas. The legendary heroes of Viking lore, men like Sigurd the Dragon Slayer and Ragnar Lothbrok, were not only depicted as physically powerful but also as mentally indomitable. These heroes were able to withstand unimaginable pain, endure seemingly impossible trials, and rise above all adversity. The Viking warriors' relationship with pain was also influenced by their belief in the afterlife. In Viking culture, dying in battle was considered the most honorable death, as it ensured a place in Valhalla, the Hall of the Slain. In Valhalla, warriors were rewarded with eternal glory, feasting, and fighting in preparation for Ragnarok, the final battle of the gods. This belief in the honor of dying in battle made pain something that could be embraced rather than feared. Pain was seen as a temporary trial, something that could be overcome in the name of achieving glory and honor. A warrior's pain was viewed as a sacrifice, and that sacrifice was believed to be rewarded in the afterlife. This spiritual belief gave warriors the strength to endure injuries that would have crippled others. To succumb to pain was not only seen as weakness but as a failure to live up to the ideals of the Viking warrior code. However, it wasn't just the warriors who were affected by the pain of battle. The effects of war rippled through Viking society as a whole. When a Viking warrior returned from battle, often bearing gruesome injuries, the pain he endured was a testament to his courage and resilience. His family, friends, and fellow villagers would view these wounds as a sign of his dedication to their cause. This cultural reverence for the warrior's ability to endure pain and survive injury elevated the individual warrior to the status of a hero, admired and respected by all. The community would celebrate the warrior's return, not just for his survival, but for the sacrifices he had made in the service of his people. The Viking way of life was one in which pain was an ever-present companion. Whether it was the physical pain of battle, the emotional pain of loss, or the mental pain of facing the harsh realities of their environment, the Vikings were forced to live with suffering on a daily basis. But instead of letting pain break them, they learned to incorporate it into their lives as something to be faced, endured, and even conquered. Pain became a tool of strength, a way to prove one's resilience and determination. In conclusion, Viking warfare was brutal, and pain was an inevitable byproduct of the constant battles and raids that defined their way of life. Yet the Vikings didn't view pain as something to be avoided. They saw it as a necessary challenge, something to be embraced and endured in the name of honor, glory, and survival. The ability to survive the physical and mental trauma of battle became a defining characteristic of the Viking warrior, and their strength in the face of pain was one of the most remarkable aspects of their culture. The legacy of the Vikings is not just one of violent conquest, but of an enduring spirit, a willingness to face and overcome pain in the pursuit of something greater than themselves, their gods, their people, and their honor. The Vikings, despite their reputation for brutality in warfare and their warrior culture, were surprisingly innovative when it came to medicine and healing. The knowledge and practices developed by Viking healers had a profound and lasting impact on later medical traditions, particularly in Europe. As Viking society expanded its reach through raids, settlements, and trade, the Viking approach to medicine spread across a vast area of Europe and beyond. The practical and holistic medical practices of the Vikings left a legacy that influenced not only their immediate descendants but also the development of Western medicine in the centuries to come. One of the key aspects of Viking medicine that would later influence medical practices was their extensive use of herbal remedies. The Vikings had an in-depth knowledge of the plants that grew in their native Nordic landscapes, and they were keenly aware of their healing properties. Herbs like meadowsweet, yarrow, garlic, and juniper were commonly used for pain relief, wound care, and infection prevention. These herbs were not only effective in treating common ailments but were also part of a broader system of natural healing that emphasized the importance of using the resources at hand. The Vikings, living in a harsh environment where access to modern pharmaceuticals was impossible, relied heavily on the natural world for their survival. The Vikings' knowledge of these herbal remedies spread across Europe through their extensive trade networks and interactions with other cultures. As Viking settlers established communities in places like the British Isles, Normandy, and parts of modern-day Russia, they shared their medical knowledge with local populations. This exchange of information contributed to the growth of herbal medicine in Europe, which would later form the foundation for much of Western traditional medicine. Over time, these herbal practices evolved, incorporating new plants and techniques, but the Viking influence remained a significant part of European medicine, especially during the Middle Ages. Moreover, Viking surgery, though rudimentary by modern standards, also laid the groundwork for later surgical practices. The Vikings' ability to perform amputation and treat severe trauma demonstrated a practical, hands-on approach to surgery that was rooted in necessity. When a warrior suffered a limb injury in battle, the immediate need for action meant that Viking healers had to be resourceful and decisive. The use of simple tools like axes, knives, and swords to perform amputations or to extract foreign objects such as arrows from wounds was a far cry from modern surgical instruments, but it was surprisingly effective given the circumstances. This, battlefield surgery, would later influence military and emergency medicine, where the need for rapid intervention in life-threatening situations continues to be paramount. In addition to their surgical skills, the Vikings' understanding of wound care and infection prevention was ahead of its time. While the Vikings did not have the knowledge of bacteria that we possess today, they intuitively understood the importance of cleanliness and the use of natural antiseptics. Herbs like garlic, which has natural antibacterial properties, and honey, known for its ability to promote healing and prevent infection, were used in the treatment of wounds. These remedies were often applied to injuries in the form of poultices, salves, or dressings, and their use became embedded in the medical practices of later European cultures. The spread of Viking medical knowledge was not limited to herbalism and surgery. The Vikings' holistic approach to healing, which combined physical, spiritual, and psychological elements, had a lasting impact on later medical traditions. The Vikings believed that illness and injury were not just physical afflictions but also signs of spiritual imbalance. Healers, known as vulvas, were often skilled in both herbal medicine and spiritual practices, performing rituals to restore harmony to the body, mind, and spirit. This integration of physical and spiritual healing would influence later medical practices, particularly in medieval Europe, where religious figures like monks and nuns often served as healers, blending prayer and herbal remedies in their treatment of the sick. The Vikings' understanding of the mind-body connection also played a role in the development of later healing practices. Their belief that mental and emotional strength could help a person endure physical pain was reflected in their emphasis on courage and endurance in the face of suffering. This focus on mental fortitude, which was central to Viking warrior culture, would later be incorporated into the broader European tradition of healing. In the Middle Ages, for example, many medical practitioners believed that a person's mental state had a significant impact on their ability to recover from illness. The idea that the mind could influence the healing process would eventually lay the groundwork for the development of psychological healing and the understanding of mental health. Another key aspect of Viking medicine that would influence later practices was their approach to preventive care. The Vikings, living in a harsh and unforgiving environment, understood the importance of maintaining good health to survive. While they did not have the luxury of modern healthcare systems, they took steps to protect themselves from disease and injury. Good nutrition, regular physical activity, and personal hygiene were all integral parts of Viking life. They also had a keen understanding of the importance of rest and recovery, particularly after physical exertion. This emphasis on maintaining physical well-being through a balanced lifestyle would later be mirrored in Western medicine, where preventive care and lifestyle management became key components of health and wellness. The Vikings' influence on medicine extended even to their interactions with other cultures. As they raided, traded, and settled in distant lands, the Vikings came into contact with a wide variety of medical traditions. In particular, the Vikings had extensive contact with the Byzantine Empire and the Islamic world, both of which had advanced medical knowledge at the time. The exchange of medical practices and ideas between the Vikings and these cultures further enriched Viking healing practices, and their influence can be seen in the later development of European medicine. For example, Viking warriors who traveled through the Mediterranean region may have encountered advanced surgical techniques or new medicinal herbs that they later brought back to their communities in the north. The Viking legacy in medicine is also visible in the development of modern pharmacology. As European medicine advanced during the Renaissance and the Age of Exploration, many of the herbs and natural remedies used by the Vikings were re-examined for their potential therapeutic properties. For instance, meadowsweet, which the Vikings used to relieve pain, was later found to contain salicylic acid, the active ingredient in aspirin. Similarly, the Vikings' use of garlic as an antimicrobial and immune-boosting agent has been validated by modern science. The rediscovery of these ancient remedies during the 16th and 17th centuries helped to establish the foundations of modern pharmacology, linking the practical knowledge of Viking healers with the scientific advances of later medical traditions. Even today, many of the remedies and techniques used by the Vikings continue to influence alternative and herbal medicine practices. The holistic approach to healing that the Vikings embraced, with its focus on the interconnectedness of body, mind, and spirit, resonates strongly with modern approaches to wellness that prioritize natural healing methods and preventive care. The use of herbal remedies, the focus on mental strength, and the understanding of the mind-body connection all reflect elements of Viking medicine that are still relevant in contemporary health practices. The Vikings' influence on medicine is a testament to their resourcefulness, resilience, and adaptability. Despite lacking the advanced technology and scientific knowledge of modern times, the Vikings developed effective healing practices that helped them survive in a harsh and dangerous world. Their medical knowledge, based on practical experience, observation, and a deep connection to nature, laid the groundwork for many of the healing traditions that would follow in Europe. From herbal remedies to surgical techniques, the legacy of Viking medicine is still felt today, reminding us of the enduring impact of this remarkable civilization on the development of modern health practices. The Viking approach to pain went far beyond mere physical suffering. It was deeply ingrained in their cultural values, psychological makeup, and spiritual beliefs. For the Vikings, pain was not simply an unwanted experience to be avoided. It was a challenge, a test of character, and a necessary part of life. Pain was seen as something that could be endured with honor, and the ability to withstand it was celebrated as a virtue. In fact, pain was a defining feature of Viking life, shaping everything from their approach to combat to their perceptions of death, suffering, and resilience. Viking warriors, in particular, were expected to demonstrate incredible mental fortitude in the face of pain. A warrior's ability to push through the agony of battle injuries, to continue fighting despite severe wounds, was seen as a mark of both strength and honor. The Vikings placed immense value on resilience, especially in combat, where the brutality of war and the constant threat of injury meant that pain was an ever-present companion. To flinch or retreat in the face of pain was considered a sign of weakness, and it was one of the greatest disgraces a warrior could suffer. Instead, warriors were taught to embrace pain as a part of their warrior identity, to view it not as an obstacle, but as a stepping stone on the path to glory. This mental toughness was often reinforced by the warrior culture of the Vikings. From an early age, boys were trained to be strong, tough, and stoic. They were taught not to show vulnerability, to endure the discomforts of training and battle without complaint, and to overcome fear and pain through sheer willpower. This was instilled through rigorous physical training, harsh discipline, and a deeply ingrained sense of pride in one's warrior status. Warriors were expected to fight on, regardless of the severity of their wounds. Even when faced with life-threatening injuries, it was considered honorable to remain on the battlefield, fighting until one could fight no longer. The Vikings' relationship with pain was also intertwined with their understanding of honor and glory. Death in battle was considered the highest form of honor a warrior could achieve. Those who died in combat were believed to be chosen by the gods to enter Valhalla, the Hall of the Slain, where they would be granted eternal life and the opportunity to fight and feast with the gods. The prospect of this afterlife provided Viking warriors with the mental strength to face the pain and fear of battle. For many, the idea that enduring pain in battle would lead to eternal glory in the afterlife made the suffering more bearable. Pain was seen not as an end but as a necessary step toward a higher purpose, a means of earning favor with the gods and securing a place in Valhalla. This belief in the spiritual significance of pain and sacrifice was a central part of the Viking worldview. The gods themselves were believed to have experienced suffering and sacrifice in the pursuit of greater wisdom and power. Odin, the chief of the gods, was the prime example of this. He sacrificed his own eye in exchange for knowledge, and his willingness to endure great pain for the sake of wisdom was a story that resonated deeply with Viking warriors. For the Vikings, the ability to endure pain was not just a test of physical strength, it was a way to emulate the gods and prove one's worthiness to join them in the afterlife. The concept of ward, or fate, also played a critical role in how the Vikings perceived and dealt with pain. Ward was the belief that the events in a person's life were predestined by the gods, and that one's fate was unchangeable. This belief meant that pain, suffering, and even death were all part of a larger cosmic plan that could not be avoided. The idea of ward encouraged the Vikings to accept their pain without resistance, knowing that it was an integral part of their predetermined journey. This acceptance of pain as part of their fate gave them the mental fortitude to endure even the most severe injuries and hardships without giving in to despair or fear. However, while the Vikings embraced pain as a test of strength and honor, they also had a deep understanding of the need for recovery and restoration. They did not see pain as something to be glorified in and of itself, but rather as something that had to be endured in order to achieve a higher goal. After battle, when warriors were injured and fatigued, they would rest and recover, allowing their bodies time to heal. The idea was that recovery was just as essential as endurance. Both were necessary components of the warrior's journey. The ability to push through pain in the heat of battle was only valuable if it was followed by the wisdom to rest and heal when the battle was over. The Viking response to pain was not confined to warriors alone. It was part of a broader cultural mindset that affected everyone in Viking society. Whether it was a farmer enduring the harsh conditions of the north, a craftsman enduring the hardships of long hours and difficult labor, or a woman giving birth in a time before modern medicine, the ability to endure pain was an integral part of Viking life. The culture placed a high value on stoicism and self-discipline, which meant that individuals were expected to bear their pain quietly and without complaint. This mentality permeated all aspects of Viking life, and it was seen as a sign of maturity, strength, and resilience. Even in the face of death, the Viking attitude toward pain remained unchanged. Death was not something to be feared, but something to be embraced as part of the natural cycle of life. In fact, death was often seen as a form of release from pain and suffering. The fear of death was minimal, as the Vikings believed that their actions in life would determine their fate in the afterlife. The idea of eternal life in Valhalla, where warriors could fight and feast forever, gave them the courage to face their inevitable deaths without fear or regret. Death in battle was seen as the ultimate triumph over pain, as it was believed to guarantee a place in the Hall of the Gods. Pain, then, was not just something to be endured, it was something that could lead to a greater reward. In addition to the cultural and spiritual aspects of pain endurance, the Vikings also had a practical approach to managing pain in their daily lives. They made extensive use of herbs, remedies, and potions to alleviate suffering, especially in the aftermath of battle. Mead, a fermented beverage made from honey, was commonly used as both a painkiller and a means of relaxation. Viking healers also used various plants and roots to treat injuries, reduce inflammation, and promote healing. These remedies, while often primitive by modern standards, were effective in managing the physical pain that came with injuries and illness. The mental strength and resilience that the Vikings cultivated in response to pain helped shape their society in profound ways. It contributed to their reputation as fierce warriors, but it also allowed them to endure the hardships of life in a harsh and unforgiving environment. The Viking approach to pain was not just about physical endurance, it was about mental and spiritual fortitude, the ability to face suffering with dignity and purpose. Whether on the battlefield, in the face of injury, or in the course of everyday life, the Vikings demonstrated an unwavering ability to endure pain without letting it break their spirit. This mental toughness, forged in the crucible of battle and hardship, became a hallmark of Viking culture, leaving a legacy that continues to fascinate and inspire to this day. In conclusion, the Vikings' relationship with pain was complex and multifaceted. Pain was seen as a test of strength and character, something to be faced and endured with courage and honor. The ability to withstand pain was not only physical but also mental and spiritual, rooted in the Vikings' deeply held beliefs about fate, glory, and the afterlife. Whether in the heat of battle, in daily life, or in the face of death, the Vikings viewed pain as an inevitable part of the human experience, one that could be overcome through resilience, wisdom, and strength of will. The Viking approach to pain, built on the foundation of mental fortitude, continues to resonate as a powerful reminder of the human capacity for endurance in the face of suffering. While the Vikings were known primarily for their warrior culture, their ability to heal and manage pain in the face of injury and illness was just as critical to their survival and success. Viking healers, often skilled individuals who served as both physicians and spiritual guides, played an essential role in helping their people recover from the wounds and ailments that were inevitable in such a harsh and brutal environment. These healers, whether women or men, were the backbone of Viking healthcare, relying on a blend of herbal knowledge, rudimentary surgical skills, and spiritual rituals to treat a wide range of conditions, from battle wounds to common illnesses. The role of Viking healers was multidimensional, combining elements of medical knowledge with spiritual practices. Healing was not just a matter of curing physical ailments, it was deeply intertwined with the Vikings' belief system, where illness and injury were sometimes viewed as manifestations of a spiritual imbalance or divine disfavor. Healers were expected to address both the physical and spiritual aspects of pain, which meant that their approach was holistic, addressing the whole person, body, mind, and spirit. This holistic view of healing was fundamental to Viking society and greatly influenced the way they managed pain and suffering. One of the most significant aspects of Viking healing was the use of herbal remedies. The Vikings had an extensive knowledge of the plants and herbs that grew in their natural surroundings, and they used these resources to create potions, salves, poultices, and teas to treat everything from cuts and bruises to more serious conditions such as infections or internal ailments. These remedies were a critical part of pain management, offering relief for injuries and illnesses that would have otherwise been debilitating. Common herbs used by Viking healers included yarrow, which was used to stop bleeding and promote healing, meadowsweet, which was used for pain relief and to treat fever, and juniper, which had antimicrobial properties and was used to treat wounds and infections. The Vikings also used garlic for its medicinal properties. Garlic has long been known for its ability to fight infection, and it was often used by Viking healers to treat wounds and prevent infections from taking hold. The Vikings believed that garlic could purify the body and ward off evil spirits, adding a layer of spiritual significance to its healing properties. The combination of the practical and spiritual aspects of healing was a defining feature of Viking medicine and reflected the Vikings' broader worldview, where the physical and spiritual realms were inextricably linked. In addition to herbal remedies, Viking healers also employed more practical techniques for managing pain and treating injuries. A common practice was the use of poultices, which were made from crushed herbs, plant matter, or other natural ingredients that could be applied to a wound or injury to reduce inflammation, promote healing, and alleviate pain. For example, a poultice made from the leaves of the plantain plant was often used to treat cuts and abrasions, while a mixture of juniper berries and animal fat might be used to treat more serious wounds or to help prevent infection. These poultices were an important tool in managing the pain of physical injuries and were often used in combination with other treatments to help the body heal. Viking healers were also adept at recognizing the importance of rest and recovery in the healing process. When a warrior was injured in battle, or when anyone in the community fell ill, the healers would often prescribe rest as part of the treatment plan. The Vikings recognized that the body needed time to heal, and while they did not have the modern understanding of biology or anatomy, they understood the importance of allowing the body to recuperate. In cases of severe injury, such as broken bones or open wounds, healers would use splints or bandages to immobilize the affected area and reduce pain. The Vikings also used animal fats and oils to soothe sore muscles or to treat burns, helping to relieve the discomfort associated with these types of injuries. Though Viking healers were proficient in the use of herbs and practical treatments, their role went far beyond just administering physical remedies. Many Viking healers were also skilled in the art of divination and spiritual healing. The Vikings believed that illness and injury were sometimes caused by supernatural forces, such as vengeful gods or spirits. In these cases, healers would use rituals, prayers, and charms to address the spiritual causes of the ailment. These rituals often involved invoking the gods or spirits, seeking their favor and assistance in restoring health. Healers would often perform ceremonies that involved chanting, sacrifices, or the use of magical objects to ward off illness and pain. These spiritual practices were deeply rooted in the Vikings' belief system, where everything, including health and illness, was interconnected with the divine. For example, one of the most well-known forms of Viking spiritual healing was the practice of rune magic. Runes, the ancient symbols used by the Vikings for writing and divination, were believed to hold powerful magical properties. Healers would carve these runes onto talismans or amulets, which were worn by patients to protect them from illness or to bring about healing. Runes were also used in spells and incantations, with specific runes being invoked to address particular ailments or to alleviate pain. The belief in the power of runes to heal was a deeply ingrained part of Viking culture, and many healers incorporated them into their daily practices. The healer's role in the Viking community was also a social one, providing comfort and reassurance to those suffering from physical or emotional pain. Pain was not always viewed purely in physical terms. It could also be a manifestation of emotional or psychological distress, particularly after traumatic experiences like battle or the loss of loved ones. Viking healers would often provide emotional support, offering words of encouragement and strength to help individuals cope with their pain. They might also engage in rituals to ease the minds of the grieving or to bring peace to those suffering from the psychological effects of trauma. Healing in the Viking world was also tied to the concept of fate. The Vikings believed that the gods controlled the fates of individuals, and that suffering, including physical pain, was a part of one's predetermined path. The idea of accepting pain as part of one's fate and enduring it with honor and strength was a deeply ingrained part of Viking culture. Healers, too, were guided by this belief, and they saw their role as helping individuals navigate the pain and suffering that was an inevitable part of life. They understood that some pain could not be avoided, and they focused on helping people manage it as best they could, either through practical remedies or spiritual guidance. The role of women in Viking healing practices was particularly significant. Many of the healers in Viking society were women, often referred to as vulvas or seeresses. These women were highly respected in their communities and were considered to possess special knowledge of both the physical and spiritual worlds. They were trained in the use of herbs, as well as in the rituals and spiritual practices that were integral to Viking healing. Women played an essential role in preserving and transmitting healing knowledge, and their expertise was often sought by both men and women in times of need. This reverence for female healers reflected the broader Viking respect for women, who were not only caretakers of the home but also leaders and spiritual guides in their communities. Viking healers were also a critical part of the Viking warrior's experience. In times of battle, when injuries were inevitable, warriors relied on the knowledge of healers to patch them up and allow them to return to the fight. Many Viking warriors were familiar with the basics of wound care themselves, as they often treated their own injuries with simple remedies such as bandages or herbal salves. However, when injuries were too severe, healers played a vital role in saving lives, using their expertise to perform surgeries, apply poultices, and administer pain relief. The bond between healers and warriors was strong, as warriors depended on healers to ensure that they could continue their duties and survive the dangers of battle. In conclusion, Viking healers were indispensable figures in Viking society, combining practical knowledge with spiritual insight to help manage pain and facilitate healing. Their ability to use herbal remedies, perform basic surgeries, and address spiritual and emotional distress made them critical to the survival of the Viking people. The healer's role went far beyond simply administering medicine. They were the caregivers, the spiritual guides, and the community leaders who helped the Vikings endure the harsh realities of their world. Their legacy, a blend of practical medicine and mystical belief, influenced the development of medical practices in the centuries that followed and remains an essential part of Viking culture today.